Welcome back to my YouTube channel Pharma Life. Please do like, share, subscribe my channel. In this video, we'll be discussing about methanol poisoning. Hello friends, today we'll discuss about methanol poisoning. Methanol poisoning is a topic in clinical toxicology. How to write methanol poisoning in exam, we'll discuss now. First, we have to start with synonym. Synonyms include methyl alcohol, methyl hydroxide, monohydroxymethane, wood spirit, wood alcohol, etc. Physical appearance. Methanol is a colorless, highly polar, flammable liquid. Pure methanol gives faintly sweet odor and crude methanol gives repulsive pungent odor. Methanol tastes bitter. Uses. It is used as antifreeze agent, carburetor cleaner, denaturated spirit. Denaturated spirit contain 90 to 95% of ethanol plus 5 to 10% of methanol. Embalming fluid. Embalming fluid is a fluid used to prevent the decomposition of body after death. Leather dyes, paint removers, windshield washing fluid, etc. I have mentioned the percentage of methanol used. This is not necessary to remember. If you remember, it's well and good. And usual fatal dose. About 70 to 100 ml is fatal. Serious toxicity is observed with ingesting 0.25 ml per kg of 100% of methanol. And fatalities occurred with ingestion of 0.5 ml per kg of 100% of methanol. Mode of action. Methanol is rapidly absorbed through skin, respiratory tract, GIT. So peak plasma levels are achieved within 30 to 60 minutes followed by ingestion. So long latent period of 18 to 24 hours is taken for toxic symptoms to appear and develop. So how methanol is metabolized in the body? In liver, methanol is metabolized. First, methanol is converted to formaldehyde and then it is converted to formic acid. Methanol to formaldehyde conversion is taken place by using an enzyme known as alcohol dehydrogenase. Formaldehyde to formic acid conversion is taken place by the enzyme aldehyde dehydrogenase. Formic acid is a toxic metabolite of methanol, and formic acid is metabolized by two pathways, either oxidation by catalyzed peroxidase system or metabolism by tetrahydrofolic acid dependent one carbon pool. Here it is catalyzed to 10-formal tetrahydrofolate synthesis. So metabolism is usually slow. So significant levels of methanol will be appeared in the body for 7 days. Coming to clinical features. Symptoms are delayed for 12 to 24 hours. Initial symptoms include vertigo, headache with stiff neck, nausea, vomiting, abdominal pain, etc. Ocular toxicity is characterized by blurred or dimmed vision and photophobia. Dilated pupils and optic atrophy is also observed. Fixed dilated pupils is seen in severe poisoning cases. Metabolic acidosis is severe. Tachycardia, hypotension, hypothermia are also observed. Convulsions is a lead feature is often followed by coma. Patient also develop Fanconi syndrome. Fanconi syndrome means it is a renal tubule disorder in which the substances to be absorbed are excreted in urine, and this results in hypouricemia, hypophosphatemia, glycosuria, hyperchloremic metabolic acidosis, etc. In severe methanol poisoning, acute necrotizing pancreatitis is also seen. And finally, the death is due to respiratory failure. Diagnosis. How we are going to diagnose the methanol poisoning? First, we'll take complete blood picture, electrolytes, urine analysis, arterial blood gases. All this we have to check, and we have to measure serum pH and electrolytes. And all this gives us the identification characters like high anion gap acidosis, elevated osmolar gap, elevated creatine and phosphokinase, elevated amylase enzyme, hypophosphatemia. And blood methanol levels show greater than 50 mg per 100 ml. This indicates severe poisoning. And if you check CT scan or MRI, symmetrical areas of necrosis in putamen of brain shows acute methanol poisoning. Now let's discuss about treatment of methanol poisoning. Patients with abnormal vital signs, visual disturbances, pulmonary edema, evidence of renal dysfunction, high methanol levels, significant acidosis or coma they have to be shifted to intensive care unit, that is ICU. First we have to do stomach wash with sodium bicarbonate. And in this case, epicac induced emesis is not recommended as this has potential to cause CNS depression. Activated charcoal does not show any significant absorption of methanol, so it is also not recommended. An effective antidote for methanol poisoning is ethanol, as ethanol also competes for the same enzyme alcohol dehydrogenase and prevent the metabolism of methanol. So methanol is excreted as unchanged form in the urine. So ethanol has 20 times more affinity than methanol to bind for the alcohol dehydrogenase enzyme. So this competitive effect of ethanol gains more time for excretion of unchanged methanol and inhibits formation of methanol metabolites, which is responsible for severe acidosis. Formic acid is further metabolized to CO2, that is carbon dioxide, and water via folate dependent system. Mode of administration: 10% of ethanol, that is 10 ml per kg IV, is given over 30 minutes, followed by 1.5 ml per kg to produce and maintain the blood ethanol level, that is we have to maintain the blood ethanol level 100 mg per 100 ml. Ethanol therapy should continue until the following criteria is met. The following criteria includes: the methanol concentration should be less than 10 mg per 100 ml. Format blood concentration should be less than 1.2 mg per ml. Next, methanol induced acidosis, clinical findings, electrolyte abnormalities, serum amylase and osmolar gap, all these should be resolved. Until this clinical criteria is achieved, we have to maintain the ethanol blood concentrations level. New antidote, that is 4-methylpyrazole 4-MP or fomepizole, is used in Western countries, as this is also similar to ethanol, as this is don't cause the CNS depression. The usual dose is 15 mg per kg followed by 12 hours. Then they have to give 10 mg per kg every 12 hours in a 4 divided doses. And then we have to increase the dose again to 15 mg per kg as long as it is necessary. So sodium bicarbonate is given as IV. 7.5% of solution is given in a slow IV, that is 500 to 800 ml. Folinic acid 1 to 2 mg per kg is also given IV for every 6 hours, as this folinic acid increases the elimination of formic acid. Folinic acid, leucovorin, citrovorin is a biologically active form of folic acid. So this folinic acid, leucovorin, citrovorin are the active form of folic acid. So folic acid is a water soluble vitamin. If convulsions is seen, initially we have to give benzodiazepines like diazepam or lorazepam. If the seizures persist, we have to change it to phenobarbital. Hemodialysis is very effective in removing the methanol, formaldehyde and formic acid. Autopsy features include cyanosis, liver and kidney damage, lungs edema, eyes retinal edema. All about methanol poisoning. In next video, we'll be discussing about one more new topic. Thanks.